I started to prioritize sleep and then see how much better I felt with a really solid sleep foundation. And then it's in that discovery for myself that I think I want everyone to understand how much putting your phones away and getting a sleep routine and really locking in that solid sleep, how much it impacts your nutritional choices and your workouts at the gym and the care you provide to your family and your professional life. And it was the same with pelvic floor issues because I feel like there's just such a void of what people know. I feel like people always associate, oh, I leaked because I had kids. And that's not wrong, but there's so much more. And it's, you don't have to leak because you had kids. And if you leak because you had kids, then there are ways to manage that leakage. And I want women to be able to do all the things that they want to do. And that's what I help to sort of teach them.
Welcome to Real Women, Real Results, the podcast where we go beyond the reps and dive into what it really takes to live a stronger, healthier, and more confident life. I'm your host, Jamie Revelle, women's fitness expert and founder of W3 Body Women's Training Gyms in Chicagoland. Each week, we'll bring you real stories, expert insights, and the tools you need to create real results. Let's get into it. Welcome back to Real Women, Real Results, the podcast that empowers women to get strong, stay consistent, and feel amazing in their bodies at any age. I'm your host, Jamie Revelle, and today's episode is one you definitely don't want to miss, especially if you're in your 40s, 50s, or beyond, or just care about pelvic health, hormones, and longevity. We're sitting down with the board-certified urogynecologist, Dr. Kelly Jirschele. Welcome.
Thank you. Thanks for having me.
Thank you for being here. Who is passionate about helping women reclaim their strength, not just physically, but hormonally and functionally as well. We're diving deep into the pelvic floor, how menopause impacts your health, and how strength training can be one of the most powerful tools in your toolbox. So let's get into it. Dr. Jirschele, let's kick things off with some education for our listeners. Can you give us a basic overview? What's your practice? What is the pelvic floor? And why should every woman care about it, even if they don't have symptoms yet?
Sure. So as a urogynecologist, I primarily focus on pelvic organ prolapse and urinary incontinence, two bothersome symptoms that impact women's quality of life. Urogynecology is a subspecialty from typically gynecology, although urologists can do it as well. And so in training, after graduation from med school, I did 4 years of OBGYN residency and then an additional 3 years of fellowship specializing in just pelvic floor disorders. My practice primarily is in women with prolapse, bulge pressure symptoms, and incontinence, but I see patients with pelvic floor pain. I see patients with pelvic floor weakness. I see patients with other symptoms that fall into those categories. And the range of options available to these patients is wide. So some patients just want to hear what it's all about and make some subtle changes day to day, like you alluded to. And then some patients end up having surgery.
Wow.
We're a 6-person group out in the area, and we've got teams of physician assistants and nurse practitioners, nursing staffs at 2 centers. We've got a whole slew of pelvic floor physical therapists that we work with. And the goal really is just, and you'll hear me say this a lot, life is short for all of us, and tomorrow's not promised. I want women to do whatever they want to do every day, and I want pelvic floor problems to not limit their ability to do those things.
Yeah, awesome. Well, you do great work.
Yeah.
Very important work. So what would you say, the most common issues or symptoms you see in women related to the pelvic floor? I mean, you just mentioned prolapse and incontinence.
So
yeah.
I think everyone's practice is a little bit different. And I think if you asked 10 urogynecologists, you'd probably get 10 different responses because practice styles and demographics and geography and interests change it. But my 2 most common patient complaints are bulge symptoms, pressure heaviness, feel like things are falling out when they're active, especially, and then leakage of urine, either with activity, jumping jacks, those things, or on the way to the bathroom when they've really got to go.
Okay.
Those are my 2, I think, primary patient complaints.
Yeah.
And I think what I'm really interested in, absolutely, I love urogynecology. I wouldn't be doing anything else. I really want women to understand their bodies better. And I wish we did a better job in this country educating women on the value of basic things. So you and I have sort of some social connections, but I lift like 3 times a week, heavy at a gym. And I think that's really important for all women to get strong and to stay strong, not only for well-being and longevity, but just for mental health and just feeling good and to take up space. But the pelvic floor issues prevent women from doing that. So I really want to pass along the message that even with pelvic floor disorders, you could do some of these things. And I wish women in general, I wish the country in general, the world understood the value of preventive medicine as healthcare and focused on wellness better. So I tell every patient outside of pelvic floor disorders, all of us need to work to achieve and maintain a healthy weight, to move our muscles some every day, to work our pelvic floor some thoughtfully every day. And everyone thinks of pelvic floor exercises as Kegels, which is not the wrong idea, but it doesn't always have to be that involved. And there's more to it than that. And it doesn't always need to include physical therapy or 90 minutes. I always say on the ground with a Pilates ring, it doesn't have to include that. Just some thoughtful energy to that work. Everyone needs to move their bowels every day. We don't spend enough time, I don't think, talking about the value of bowels and regular bowel movements and how it impacts pelvic floor, especially. And then the last, and we'll talk a little bit about hormones. I do think at a certain point, some women should be using vaginal estrogen locally to augment the tissue support in those areas.
Yeah.
I want everyone to understand those things outside of pelvic floor issues. And I always say, when we were in the 5th grade and we all got together as 5th graders to learn about our period and how our body was changing, I said, we need to do that again for women as we approach 50 and as our life is about to change through the end of our reproductive life. We have to talk about it so we know what to expect and can manage it.
Do you feel like that is changing at all? Because I feel like there's some buzz around it, which is really good, whereas before it was very taboo.
Right.
And now I feel that people are not only talking about it, but women are much more vocally interested or outwardly interested.
And there's a lot of more opportunity to get information. I think the irony of these sorts of things is that I think it's excellent that people can get information from all kinds of sources. I think it provides some challenges because you're not always sure of the author where that information is coming from. So I think there is an opportunity for people to be taken advantage of a little bit when people start to explain their opinions without any really true facts. So I think it's a slippery slope kind of, but I love that we're talking about it. I love that there's a more opportunity to get the care that these patients need. For example, for pelvic floor physical therapists, and I know we've talked about some locally, when I started all of this, I graduated fellowship 2014, 11 years, there were maybe a dozen. And now I've got a curated list of more than 45 in all kinds of geography. And so it just is growing. And I really think that's helpful to increase resources, to increase understanding, and to make sure women get the care that they need.
Yeah, absolutely. What you were talking about with some of these issues and, doing very intentional things for your pelvic floor on a daily basis, is this something that particularly those who are going through menopause should focus on, or not necessarily? You're speaking widely.
So I think
about all
everybody, every woman. So I tell patients, every woman, regardless of your symptoms, should be doing these 5 things. They're not all applicable based on age, but all women should be thinking about pelvic floor work somewhat. Unfortunately, also there's a lot to learn and we make a lot of mistakes. And so correcting some of those mistakes can be useful just for long-term pelvic floor wellness.
Yeah. And are there any changes that begin to happen in the pelvic floor as women approach perimenopause and menopause?
Absolutely. So tissue integrity, the real reason I talk about the addition of vaginal estrogen. So as we age, your hormones decrease, their production of estrogen eventually stop. You see that in the tissues of the vulva, vagina. You can have an increased tendency toward urinary tract infections. You can have intercourse discomfort where there wasn't any before, vaginal dryness. It also, as the tissues change, it makes you more aware of pelvic floor issues. So where you could have had prolapse for a while, you're just not symptomatic from it until the skin changes, or leakage becomes a lot worse. I've seen personally in my life, you tend to focus in a little bit more and you care about some things less, but you care about some things more. So you sort of, raise your family if that's how you did it, and you kind of ignored yourself for a while, and now you're more self-aware and prioritizing yourself a little. And so we see some of that
I bet.
come with it.
Yeah. On the flip side, so not menopausal women, but those who are still in their reproductive years, do you think that, and I'm thinking back to when I was pregnant, prior to that, I had zero idea about pelvic floor.
Right.
Like, and I'm a female and I'm almost 35.
Yeah.
Back a few years ago, I'm in my early 30s knowing nothing about pelvic floor. It's like, that's kind of weird.
Right.
Especially working with women for how long I've been working with women.
Exactly.
And what I did learn about it, and I got really interested because I'm like, oh my gosh, I want to do what I can to prevent issues as much as possible. I had a friend who had a really bad experience just post babies and had to do pelvic floor therapy.
Right.
And so I got really interested in it. And I'm like, but it was all my own research. And I'm like, why isn't the doctor saying anything about this to maybe prep? Like there were no conversations about it at all.
So I think it's challenging for a couple of reasons. And, this conversation we're going to have could spur hour-long conversations about lots of things. I think one of the challenges in medicine today is there are so many things that have to be covered: depression, hypertension, diabetes prevention, thyroid wellness, menopause or menstrual cycle, all those things. There is just so much to cover in a standard visit that I don't think we do a great job of delving into the other things that we should have a good sense of baseline, right? I don't think we as global citizens do a good job even of talking about mental health, positive or negative, right, as a baseline. So I think there's lots of opportunity to sort of change the discussions. But when it comes to pelvic floor issues, the challenge becomes, so you bring it up to a patient, let's say, and then you've got to know what to do with it. Right. And you're not alone in, I don't understand the pelvic floor. I don't know what to do about it. The providers are the same. And so if they don't understand, oh, my patient's complaining of leakage, where do I send her? What do I do about it? The other issue is if you tried right now to get into certain pelvic floor physical therapists, there's a 4 and a 5 month wait. Patients have to wait to see urogynecologists because there's not a lot of us. There isn't enough provider support to feed the need quite yet. And I really do think that every woman should have pelvic floor physical therapy at least once in their life. On the reverse of that is you have to acknowledge then that means we need enough physical therapists to do all that work. And we don't have that yet.
Yeah.
And so I tell my patients who've gone to physical therapy, now it's your responsibility to then go and tell your friends and family.
Yeah.
And to sort of learn it.
Yeah.
But we need to do a better job of identifying problems, ways to prevent those problems, but also ways to screen so patients know.
Yeah.
I don't think anyone's cracked the code on what's the best way to do that now.
Yeah.
Some big institutions have centers that you can go to after delivery and certain programs in place, which is one of the ideas. The challenge is, remember, navigating your baby at home. The last thing I was thinking about was pelvic floor.
Yeah. Yes.
Right. I needed to feed and then figure out how they were going to sleep.
Yeah.
So
Right.
it's just a lot.
Absolutely. Yeah. You make a great point. I mean, there's just so much.
Right.
How can you possibly cover it all?
Right.
Yeah. So shifting back to, well, women at any point in their life after having a baby or menopausal, if they're in menopause, if they're feeling symptoms like leakage or pressure and, feeling kind of embarrassed about it, what impact in your mind, because it sounds like a lot that drives you is to change that for them.
Sure.
What impact does that have in their everyday life?
Right. And I think that's what's variable. And I want to just point out one other thing. Pelvic floor issues in general are a complex combination of risk factors. So it's pregnancy and delivery, but it's not that alone. Lifestyle, recreational activities, hormones, habitus, who they are genetically. So not all of the women who have pelvic floor problems have had pregnancies. Not all the women who have pelvic floor issues have delivered. And so I don't want people to think that, well, I haven't had kids, these aren't my problems. That's not the case. And because it's so multifactorial, I don't think you can blame any one thing.
Yeah.
Right. I don't know that necessarily tending towards C-section prevents the problems that a vaginal delivery would. Right. I don't think there's just clear lines drawn between those things.
Yeah.
And you bring up the other really good point is that not all pelvic floor problems and symptoms are impactful to day to day. So the way I manage with patients is what is impacting your ability to be active? What symptom bothers you the most? Because there are people who have some leakage of urine, let's say, with specific scenarios, and they know that, and they're fine limiting. The big one is jumping on the trampoline, right? I see lots of patients who are like, well, I leak if I jump on the trampoline, but I'm fine not going to a trampoline park. And it doesn't bother them enough in their day-to-day to do anything about it. So I like to focus on what symptoms are impacting the activities you want to do and where you want to go from there. The real challenge with pelvic floor disorders, and I'm not quite clear on the most diplomatic or appropriate way to say this, is these are quality of life issues. They're not life threatening. That's something you have to manage.
Mm-hmm.
So if you leak on the way to the bathroom, you can manage it and you're fine with it. I'm fine with it. Right.
Mm-hmm.
If you're not working out in your gym, let's say, because you don't want to do jumping jacks, that is where I think there becomes a really slippery slope,
Yeah.
because then that's going to impact long term your cardiovascular wellness and your potentially your mental health and your psychosocial well being. And so I think it's the message I relay to patients is it's in that avoiding activities where I see the real hope to manage.
Yeah.
And if sometimes his patients are like, yeah, I leak, but it's fine. And then you sort of talk to them, they're like, well, I don't like to go on long walks, or I don't do any of the high intensity stuff at the gym. And it's like, okay, you really want to limit, because that I think it's the limiting of those activities long term.
Yeah. That was going to be my next questions. What would you say to a woman who's avoiding
Right.
strength training in particular because of that?
I think we're aligned in that as you come into your gym, strong is beautiful. All of us lose muscle mass as we age. The only way to combat that is to work those muscles and to
Right.
stay strong. And I tell my patients I lift heavy 3 times a week. I'm a huge proponent of it. And I want patients to do what activities they want to do. And if they can't, then we need to find some way to manage. And that doesn't mean surgery. There's lots of conservative ways that can really help. And so I really encourage patients to avoid the limiting mindset and to try to address the issues that are preventing them from being active. And I really promote strength and resistance training for women, especially. There's so much, you see it day to day, I'm sure, misconception about I can't lift heavy because I don't want to be bulky and I don't want to get big, and all of that is just wrong.
Yeah.
And we have to work to change that.
Yep.
And so much of what happens in all of us as we evolve through our reproductive life and then out of our reproductive life is unpredictable.
Mm-hmm.
But the one thing that we know predictably is that strength training helps
Yes.
all of it
Yeah.
consistently and is valuable. So
Yeah.
I think they should all be doing it.
On the podcast that I launched today, it was a myth busting podcast,
Right.
and it was about how strength training, that's a myth,
Right.
that
For
it makes
sure.
you bulky. And I talked about it there. But I think the other thing that I want to really talk to women about is when they want to just focus so much on cardio,
Right.
but they want to be strong.
Right.
The one thing that I just really need them to understand is you can't get strong without strength training.
Right.
And the more you prolong it, I mean, then the more you're prolonging feeling stronger.
Right.
So it's the best time to start is today.
Right. It's true. And then I think there's also the next level to that is I think it starts honestly aesthetics, right? People want to look good, but eventually it's about feeling good. And then after that, it's about being able to do your activities of daily living and to not break something when you fall. So
Yeah.
I think when you start to delve into the value of true strength training, it just reaps dividends
Yeah.
long term.
You can't beat it. Totally.
Exactly.
So I'd love to hear more about you and what inspired you to become a urogynecologist. I think you kind of touched on it,
Right.
that passion, helping women really live their best life. How did you become so passionate about helping women through strength and education and menopause support?
So I love what I do. I always say that I pray everyone gets to do what they love, because then it's just so much more fulfilling. I have 3 sisters. So my mom had 8 brothers and then had 4 daughters.
Wow.
So I come from a lot of girls, and I see the value in strong women helping women be stronger, empowered women empower women. And
Mhm. That's my
so
shirt.
oh,
Yeah.
there you go. Exactly.
Yeah.
And I was interested in helping women understand exactly what's going on, because you're not alone in understanding pelvic floor issues and these problems. And I saw a lot of it. And so in my training, I knew when I started med school that I wanted to focus on women. I'm just devoted to women being the best that they can be. And the assessment of where my skill sets were and what my interests were, it really just came to urogynecology. And it seems a little silly to say, and maybe I shouldn't admit this out loud, but as a doctor, I don't love sick patients, right? I really was more driven to quality of life. Let's optimize the time we have here. How does that work best And so that's sort of what drew me to it. And then the more I do it, the more misunderstanding you see out there, the more you feel obligated, right? I'm sure you feel the same way, driven to help people understand exactly what they should be doing and how we can help them get there.
Yeah. Live the best life.
Exactly. Because it's short for all of us. Tomorrow's on promise. We got to optimize today.
Yeah. Well, your work is much appreciated
Thanks.
by many.
Yeah.
And I know you teach your patients about the 5 pillars of a
Yeah.
healthy pelvic floor. So can you walk us through those?
Okay. I just don't feel like we understand wellness or just health well enough. Personally, you evolve. I'm in my late 40s. I'm going to be 50 this year. You evolve through life and you're not sleeping great and you're making poor food choices and you're kind of getting by. And then as life catches up with me, first it started for me with sleep. I started to prioritize sleep and then see how much better I felt with a really solid sleep foundation. And then it's in that discovery for myself that I think I want everyone to understand how much putting your phones away and getting a sleep routine and really locking in that solid sleep, how much it impacts your nutritional choices and your workouts at the gym and the care you provide to your family and your professional life. And it was the same with pelvic floor issues because I feel like there's just such a void of what people know. I feel like people always associate, oh, I leak because I had kids. And that's not wrong, but there's so much more to it. And you don't have to leak because you had kids. And if you leak because you had kids, then there are ways to manage that leakage. And I want women to be able to do all the things that they want to do. And that's what I help to sort of teach them.
Yeah.
So they understand it.
The 5 pillars.
Right. So the first one is achieve and maintain a healthy weight, which I think is so challenging to talk about. And it is really important. And it's staggering to me. And I don't have the exact statistics, but if you look at the American Cancer Society's #1 risk prevention strategy to decrease the risk for cancer, it's achieve and maintain a healthy weight. We don't talk about that, right? Everyone talks about how I don't smoke or I don't do these things as cancer prevention, but nobody talks about achieving, maintaining healthy weight. It's not easy and it's not sexy, but it is what we all need to be working on. Pelvic floor problems also, there's got to be a way to talk about the disadvantage of extra weight and how it impacts other things, diabetes, hypertension, pelvic floor disorders without fat shaming or without guilt, just as a fact-based discussion.
Yeah.
And I talk about it with all patients. And it is unfortunately true that even a small amount of extra weight makes all pelvic floor symptoms worse. And so I see it every day in my work.
Yeah.
It's interesting to be this point in life because I know what happens as we evolve out of our reproductive life and how unpredictable what used to work doesn't work kind of can be. So I started talking about healthy weight. And I also think if I talk about healthy weight with everybody, it has no value. There's no judgment with it, right? This is just extra weight makes symptoms worse. That's it.
Yeah.
And we talk about
what it is.
We all need to move our muscles. I do think that the activity is the key to longevity. I don't think we appreciate the value of just moving our muscles for mobility for long term. And the older I get, the more I think about long term and what the future holds and how we can best protect ourselves as we age. I think aging is a privilege we're not all afforded, and moving certainly helps optimize that. And when you're working to achieve a healthy weight, when you're moving more, you are improving overall pelvic floor wellness, which is going to decrease your symptoms. And so everything I talk about is through the lens of pelvic floor, but it's applicable across the board. The pelvic floor exercises, I think, is a big one because lots of us focus on our triceps and our biceps and our quads, and we forget that your pelvic floor is the foundation of your core. Use it for everything. And it's a bowl of muscles that has to be built and sustained in order to see long-term success with improvements. And so I talk about directing energy, thought, and blood flow just to those muscles, just like you would when you're doing bicep curls or other leg exercises at the gym. Most people think of pelvic floor exercises as this kind of, I got to add in all this extra time. It really doesn't have to be that. It can be that. And for patients with significant symptomatology, probably it is. And with weakness, you have to build up the strength. But for most of us, we just need to devote some energy every day to thoughtful work on our pelvic floor. When we're doing something else, when you're at the gym lifting heavy, you need to make sure that you're engaging your core and pelvic floor in a way that supports those things as you do the exercises. And so it's kind of finding that for them.
Mm-hmm.
And I tell patients sometimes they can do it on their own. Sometimes you establish care with the physical therapist who guides you so that you eventually have some on your own.
Yeah.
The bowels is a big one. If I could change one discussion piece I already said, it would be to talk about the value of us bowels every day. And especially when it comes to pelvic floor disorders, because bowels that don't move well, bowels that move too frequently, too loose, or too not well enough and are delayed in their movements dramatically impact leakage, bulge, pressure, heaviness, fullness, all those things.
Mhm.
And so it comes back to optimizing fiber choices. We really need 35 grams a day of fiber in what we're eating and drinking. I think it's really hard to get that every day in food. So I recommend you aim for high fiber choices, but I think every woman should supplement a little every day just to bridge that gap.
Mm-hmm.
And then make sure you're doing what you need so bowels are optimized. So it's focusing on that every day because it's so helpful. And then the last is the vaginal estrogen piece, addressing the tissue integrity issues that are changing as we evolve out of our reproductive life that impact these things.
Mm-hmm.
The benefit of topical estrogen cream is it does not increase your blood level of estrogen. It doesn't come with an increased risk of cancer or clot. And the discussion, as we've talked about a little bit earlier, around hormones is changing. And I think more availability of hormone replacement and providers for hormone replacement and discussion about hormone replacement, I think we're improving the discussion around those topics. But there are still a lot of reservations and hesitations. And local estrogen doesn't come with some of those same considerations. And so I think it's an easier sell for
Mm-hmm.
patients.
Yeah. They're more comfortable with it.
Right.
On a quick side note, what you were mentioning about fiber, and this was mentioned by what registered dietitian that I had on a different episode. But something I forgot to mention to her was that I was recently at a conference. Hank was there actually, and there was a speaker. He's one of like the most renowned trainers in the world, in the country. He trains a bunch of movie stars and stuff. He's out of New York, but he was talking about like just the nutrition component. Actually, his talk was about fat loss and helping clients who are trying to achieve fat loss.
Sure.
And on the nutrition side, he was talking about fiber. And so I keep hearing more talk about 35 grams of fiber, whereas honestly, a year ago and beyond, I don't think I remember hearing about that.
Yeah.
So definitely very important for all of our listeners. Pay attention to your fiber intake. So, based on your 5 pillars, what are 2 to 3 simple habits a woman can start today to take better care of her pelvic health?
So I think I would start with prioritizing bowel movements. So just assessing how things are moving and optimizing that, whether it's adding a little bit of additional fiber or increasing hydration to help just somehow improve the efficiency with which the bowels move, which will dramatically help. Overall understanding of how general wellness impacts pelvic floor. If you're eating crap, you're going to feel like crap, all over, your pelvic floor included, right? And so just looking and understanding how some of those other choices impact how you're feeling overall. Incorporating some subtle pelvic exercises into every day. It doesn't have to be elaborate. A little bit is enough. You have to build the strength and then sustain the strength. And so working on good bowel habits, overall wellness, and pelvic exercises, I think is key.
Yeah. Is that something that you feel like a trainer should cue?
So that's a good question. There is also so much that a trainer has to do. I think what I see in patients and then just in friends is just going to the gym and deciding what to lift is really daunting. So if you have pelvic floor issues or other problems, it's even worse. And they just don't. There's a statistic that, and I don't have it exactly right, and I could find it, but a third of diabetics don't get treated because of shame. And I think that carries over across the board to big, heavy people don't work out in gyms because they're embarrassed. And people aren't doing the gym exercises because they don't understand how to do them. And so I think to tell a trainer, well, you've got to cover all these things, I think is really not reasonable, right? I think a trainer should understand how to get a patient to additional treatment if they need it. If you find like you see you're doing a fitness class and you notice one woman not participating in jumping jacks, like just an aside, like I see you're not doing jumping jacks. Are you having issues? I've got physical therapy recommendations. There's urogynecologist. You just understanding how you can get them help if they need it. I think it's unreasonable to think we all have to be able to do everything.
Sure.
But just understand what resources are available to get them doing those activities, I think is helpful.
Yeah.
And I also think it's so welcome to just sometimes bring it up
Mm-hmm.
because people don't talk about these things. And I think you're right that some of these issues are no longer taboo,
Mm-hmm.
but just giving it a name and, hey, we can manage these things if you want to.
Well,
You're
now,
not alone.
yeah. And it's not for me because I'm in the
Right.
wellness world. It could be for a
Right.
woman who's 40, 50, 60 years old, 70, who for majority of their life, it was taboo and they're
Yeah.
not in the wellness space. And so
Exactly.
it might definitely, they'd be like, wait, what'd you just say?
Right. So for a pelvic floor disorder, 1 in 3 women will have some symptoms. So it's
Wow.
really common.
Mm-hmm.
So we just have to talk about it
Yep.
and
Bring awareness
get it.
to
Yeah,
it.
absolutely.
Yeah. Yeah, and it's funny you mentioned the jumping jacks thing because we start our workouts with jumping jacks, and there are many women who
Right.
modify.
Yeah.
And so yeah, I'm glad we're having this conversation
Right.
for them. I hope they listen. I'll, of course, blast it out and
Right.
get my members to learn a little bit
Right.
more. And then, of course, we'll link all the resources we can to you
Sure.
to pay you a visit. But that was actually going to be also one of my next questions is what are those red flag symptoms that to me as a member, as a client, like I need to modify or I might need to change this up a little bit. Obviously, leakage.
So yeah, leakage. And I think a big one is pressure.
Mm.
And it's interesting. The heavier you lift, the more you could potentially feel bulge symptoms, pressure, like things out of place.
Mhm.
It's interesting. We could have a very long conversation about cause and effect. And I don't think you should limit activities because of prolapse. I think you can improve strength, work on ergonomics, modify practice, and still do those things. But I know leakage and bulge symptoms are big ones to limit what patients are do or clients what they're willing to do
Mhm.
than just offering the space. I know you don't want to lift heavy because you're worried about bulge symptoms. Let's manage those bulge symptoms so you can lift heavy.
Sure. Yeah, absolutely. Outside of what we already spoke about in terms of like bone strength
Yeah.
training, especially for women over 40, 45, for
Right.
bone density and
Mhm.
pelvic integrity, why do you think strength training is one of the most effective tools to support hormonal health, especially as their body's going through changes? Because I find a lot of buzz around this for
Right.
women going through menopause, but I struggle to find the best way to describe it to people, clients coming in. It's like they're coming looking for strength training. They don't want to
Right.
go to a big gym because they don't know how. Or
Right.
for us,
Yep.
possibly because it's co-ed, and they're like, I was told I need to strength train.
Right.
So I'm glad. But how would you put that into terms that are easy to understand in terms of the impact it has on hormonal health for women who are
So
perimenopausal
I
and menopausal?
would, and I think it gets challenging to open up that hormonal piece because I think that really is a Pandora's box and it can go lots of different directions.
Mhm.
The way I explain it is that your muscles matter long term, and all of us decrease our muscle mass as we age. That's just the aging process. And so, doing the best you can to have the most robust muscle strength as early as possible so that you've got a little bit of wiggle room when it comes to a little bit of loss with a big solid foundation is significantly less impactful than a little bit of loss on a weak foundation.
Mhm.
And that you want your muscles to work for you. Your muscles are ultimately what's going to prevent you from breaking a hip if you fall or catching yourself if you fall. And your muscles can help improve it's not calories in, calories out, but you want to put your muscles to work for you so that your muscles are burning the fuel to power you.
Yeah, more efficiently.
Yeah.
If a woman is struggling with symptoms or feels lost during menopause or any
Mhm.
stage of her life, really, and maybe hasn't been heard by her doctor,
Right.
what message would you want her to hear right now?
That she needs to find her voice.
Mhm.
And it's really challenging because doing a better job, I think, overall, talking about how our bodies are changing and there are more and more menopause practitioners. The menopause.org is a really great resource. You can plug in your zip code and find a local provider would be willing to have those conversations with you. There are providers who are especially trained in just the menopause management. I really think patients need to be their own advocates, and it's challenging. But I really say if you go and you present what you want to your provider and you're not getting heard, I would suggest talking to someone else
Mhm.
and educating yourself. I'm sure you've seen hundreds of books on menopause, and some of the science is complicated and it's not easy material to understand. I think the value in some of those books really is the section of, okay, this is what I need to know, and I'm going to go talk to my doctor. Here are some options that I can think about. And so I think formulating a plan can be helpful. I think that's also, again, a double-edged sword because it really is challenging as an expert in pelvic floor issues when someone comes to me with their 10 pages of ChatGPT and they're like, well, it says I need to do this. There needs to be a different dialogue.
Yeah.
I do think knowledge is power and trying to find the right person to hear what you're saying.
Yeah.
Professional standpoint for me, I'm doing my best to try and reach out to the gynecologist, to the family practice docs, to the internal medicine docs to sort of explain, hey, this is what I'm doing. This is what's available. The patients who have pelvic floor problems don't have to see a urogynecologist, right? You could send someone to pelvic floor physical therapy. They could manage their symptoms and then they never need to come and see me ostensibly, but getting a general understanding for all of us about what the problems are and where we can go to manage those, I think is helpful. I just think so much is about self-awareness. So you have these symptoms, you're not understanding what it is, trying to get some answers. So doing the research, talking to different people, which is why I think it's so important we do these kinds of things because you wouldn't think necessarily that you'd get your medical advice from your buddies at the gym. But if your buddies are at the gym, they're warming up 10 ends together 3 times a week. That's who you're talking to.
Right.
Right. And it takes one person to have a connection to, oh, I read about this fiber. And that's how it starts.
Yeah. And let's say you have someone that you're speaking with who they need to start strength training.
Right.
What advice would you give them on where to begin?
I think everyone should have a trainer. I don't think you need a trainer forever, but I think you need a trainer to tell you how you need to do what you need to do. And I do the same reason I think people should see a pelvic floor physical therapist. I can tell you what to do, but that's different. You want to go and have somebody lay their hands on, do the evaluation and help you devise a strategy so that you know what you should be working on.
Yeah.
The same with strength training, because all of us, myself included, you train what you're good at, which is the exact opposite of how you should train.
Yeah.
So I go to a trainer for him to tell me to do the things that I hate.
Yeah. Right.
And that's what I think they have to do. So I tell them that you need to find a trainer.
Yeah.
And there's some programs online because it's not available for all people to get into a gym. But so you have to focus on starting somewhere with a specific plan in mind.
Yeah. Yeah, I think that's the beauty of a trainer outside of the most obvious benefits is the structure and the plan that it provides to get you from get you from where you're at now to where you want to be. And yes, there's so much information online and there's ChatGPT, but the value, just like with a doctor, is having that person, the expert in front of you, holding your hand through the whole thing.
Right.
Yeah.
And I think there's also really tremendous value in the community that you get at the gym. So these kinds of gyms, and I mean, this sounds sort of corny, but these kinds of gyms I think are the best because it takes, and I'm not like everyone, but for me, it takes me seeing someone else at the gym putting up a weight that I wonder if I could do that to then inspire you to do it. And then you do it and then you inspire somebody else to do it. And the community that is involved with it, I think is fantastic.
It's interesting. I just saw something from someone in the fitness industry who was talking about marketing because I'm always talking about community first, gym second. We always say that with what we do. But I don't know if people outside of the gym understand the value that like you almost have to experience it to be like, oh, I don't want to leave this community.
Right. Which is why, and we share in common my trainer that you know well, but he gives everyone a free trial. Come in and try it. Just see what it's about because you're absolutely right. Until you're in it, it's hard to understand it.
Yeah.
Until you start seeing what it can do, especially with the community.
Absolutely. Yeah.
It's tricky.
Yep.
But totally worth it.
I was just going to say. So last question for you. What does being a strong woman mean to you right now in this stage of your life?
So it's so interesting because in every stage of life, I think it changes. I love getting to this point because you can look back at yourself in your 20s and your 30s and your 40s and be proud of who you were, but more proud of where you're going. And so I think being a strong woman is understanding what you want and then making choices and decisions every day to get what you want.
Yeah.
the other thing that's really exciting is seeing other people succeed, right? When you have kids, nothing is like the pride in watching your children succeed, walk for the first time, talk, make friends, do their athletic endeavors or academic endeavors. There's just such pride in doing that. And I feel the same way with women, right? I feel the same way at my gym when I see my buddy who I've been working out with for a long time put up a really heavy weight. I see the same thing in my patients who come to me with all these problems, sort of distraught. And I recommend something like pelvic floor physical therapy, and they sort of make a face. And then they go to physical therapy and they feel great about it. And they want to tell their friends about how great they can feel about it. And I think we really need to keep bringing others up and realizing that when you do that, we're all getting stronger.
Absolutely.
Yeah.
Yeah. I really love the way that you talk. Well, your passion comes through
Sure.
when you
Thanks.
talk, which is awesome. But I think if anyone were to listen to this podcast or listen to you when we have our workshop coming
Right.
up, shout out to that. It's like you give them hope,
Right.
Right. Which is awesome.
Yeah.
Like whether someone's nervous about potentially
Exactly.
having these issues or
Right.
they currently are and they've never done anything about it, like you speak with such conviction that
Right.
I imagine. Yeah.
And that's what I want because we've got to talk about these issues.
Yeah.
And they are really important to a lot of people. There are lots of solutions. And I joke, I tell everyone that I see, 1 in 3 women. And then I say a lot all day, every day. I'm like, welcome to the club. It gets a lot of mixed reviews, but it's really nice to have a community. And maybe it's not. I don't want to be part of people who leak community, you know what I mean? And maybe it's not a club I want to be part of, but it's great to know
Yeah.
that there are other people who have similar issues and there are lots of ways to manage.
Yeah. There's power in that for
Right.
sure. Anything else that you wanted to touch on?
So I think, and you talked a little bit about this, I think one of the great segues with that theory alone is the idea of menopause and as your hormones shift, right? I think historically we think of menopause as hot flashes and terrible.
Mhm.
And there's a lot of doom and gloom associated with it. And I really want to work with others who are doing these things as well to sort of change that narrative. I want there to be hope about the idea that this isn't the end, right? Lots of us are going to live as long in menopause as we lived in our premenopausal
Yeah.
and reproductive years. And so giving it a voice and a hope so we know what we can do with those things, I think is really valuable.
Yeah, absolutely.
Yeah.
I recently listened to a podcast on the other side of that that was really just about uplifting women during menopause, speaking
Right.
of the physiological changes happening in like their brains and like their wisest years.
Right.
So again, like speaking to what you're saying is
Right.
what a great positive way of thinking about it. Yes, outside of the physical symptoms,
Right.
which hopefully we can manage well,
Right.
is all of these awesome, promising years.
Exactly.
Which is cool.
And I think it helps me a lot to try to gain some perspective that not everyone gets there. Tomorrow isn't promised.
Yeah.
And sort of think about it that way. We're only given so many days. So I want to make the most of them.
Yeah,
Optimize those.
awesome. Well, where can people learn more about like your work, your clinic?
I think I'm not super tech savvy, but I think it's easy to attach links.
Yeah.
So menopause.org, if they're looking to delve into menopausal symptoms or symptom management, our International Urogynecologic Association and the American Urogynecologic Society. And I brought some handouts that just are what I talk to my patients about. There are a ton of patient handouts there at those sites. And
Okay.
both of those, augs.org and iuga.org, both have patient portals that are full of information for things that you can read about and learn about on your own, but then also opportunities to plug in a zip code and find a provider in your area
Cool.
to look up where there are pelvic floor physical therapists. I'm part of Illinois Urogynecology, private practice urogynecology group here in this area. And so we can put my link to that stuff
Perfect.
as well.
Awesome.
Yeah.
Well, sounds good. Dr. Jirschele, thank you so much.
Thank you for having me.
Yeah, for sharing your knowledge and your energy and your hope, your commitment to helping women live stronger, healthier lives. This conversation was full of powerful takeaways, and I know our listeners are walking away with a better understanding of what's possible no matter their age or stage. If you enjoyed this episode, share it with a friend who needs this information. And remember, strength isn't just about muscles, it's about showing up, learning your body, and making empowered choices that support you for life. Thanks for tuning in to Real Women, Real Results. If you loved this episode, be sure to follow the podcast and leave a review. It helps more women find these powerful stories. If you're local and want to join our gym, check out our 4-week trial. Head to train@w3body.com for more info. And don't forget to follow us on Instagram, w3body_Berwyn and w3body_Elmhurst for more strength, support, and community. See you next time.